Namaste everyone, welcome. And I hope you are in good health as well as scaling new heights in your career. Today, we are going to take a concise look at the fascinating world of antidiabetic drugs or medications, which are crucial for managing diabetes mellitus. With so many options available, understanding how they work and how they're classified is important. So, let's dive right in.
Our first category is the biguanides. The most well-known drug here is metformin. Biguanides primarily work by reducing glucose production in the liver and improving the body's sensitivity to insulin. They're often the first-line treatment for type 2 diabetes due to their effectiveness and relatively low cost.
Next, we have the sulfonylureas. This class includes medications like glimepiride, glipizide, and gliclazide. Sulfonylureas stimulate the pancreas to release more insulin. They've been around for a long time and are effective in lowering blood sugar levels. Other examples in this category include drugs like tolbutamide and gleburide.
Moving on, we have the alpha-glucosidase inhibitors. Examples you might know are acarbose, miglatol, and voglibose. These drugs work in the gut by slowing down the breakdown of carbohydrates into glucose, thus reducing the post-meal spike in blood sugar.
Our fourth category is the meglitinides, with drugs like natglinide and repaglinide. Similar to sulfonylureas, meglitinides also stimulate insulin release from the pancreas, but they have a shorter duration of action and are typically taken before meals.
Now, let's talk about the DPP-4 inhibitors. This is a more recent class with several members, including alogliptin, saxagliptin, linagliptin, sitagliptin, vildagliptin, and even trelagliptin. DPP-4 inhibitors work by preventing the breakdown of incretin hormones, which in turn increases insulin release and decreases glucagon secretion.
Another relatively new and exciting class is the SGLT2 inhibitors. Examples include ertugliflozin, dapagliflozin, empagliflozin, and canagliflozin. These drugs work in the kidneys by blocking the reabsorption of glucose, leading to its excretion in the urine, thus lowering blood sugar levels.
Our next category is the GLP-1 analogs, such as exenatide, dulaglutide, semaglutide, and liraglutide. These drugs mimic the action of the natural GLP-1 hormone, which stimulates insulin release, suppresses glucagon secretion, slows gastric emptying, and can even promote weight loss. Some newer agents in this class are administered less frequently, offering convenience.
We also have a category called bile acid sequestrants, with colsevlam being an example. While primarily used to lower cholesterol, it has also been found to have a modest glucose-lowering effect in some individuals with type 2 diabetes.
Another interesting drug is bromocriptine, a dopamine 2 agonist. While primarily known for treating Parkinson's disease and other conditions, a specific formulation is also used to help improve blood sugar control in type 2 diabetes, although its exact mechanism in this context is still being fully understood.
Finally, we have the thiazolidinedians, often called DIs. Examples include pioglitazone, rosiglitazone, and lobeglitazone. These drugs work by increasing the body's sensitivity to insulin in peripheral tissues like muscle and fat, and also reduce glucose production in the liver.
So, as you can see, the classification of antidiabetic drugs is based on their primary mechanism of action. Each category works in a different way to help manage blood glucose levels in individuals with diabetes. it's important to remember that the choice of medication depends on various factors, including the type of diabetes, individual patient characteristics. Thanks for watching.